Thank you so much for having me here today. I want to apologize in advance. I have a touch of laryngitis, so I'm going to power through this the best I can. I'm just so thrilled to be here with these fantastic gentlemen and other presenters here today. And what I'm going to be talking about is the culture of health that we're building here at The Ohio State University that really is getting national attention now, so I'm thrilled. We all have heard about the ripple effect. The ripple effect, as you know, is when you take a solid object, usually a stone or a pebble, and we've all either observed or initiated this effect, where we've dropped it into a body of still water. And we watched how those ripples just permeate out very symmetrically. And after the ripples die down, we think for a minute about, we think we know where that pebble went and where it started, but we're not sure where it ended. And I feel like that is the way my research is going, standing on many of the giants here at The Ohio State University that lift me up daily. So we've all been affected in this room by the ripples of cancer, and this is where my research started with adult cancers. We now know that predicting the future and with obesity, that we can expect that 1 in 2 men in this room will be diagnosed with cancer in their lifetime, and 1 in 3 women. We've had great strides in combating cancer, so therefore we have many more survivors. Over 15.5 million currently in the United States, adult survivors, and that's anticipated to grow by 30% in the next 8 years. So we're doing a great job, again, largely in testament to the work done at The Ohio State University with treatment and early detection and surveillance. But where we still have gaps is after they leave and walk out the door. And if we can't attend to folks' dietary patterns and their physical activity patterns and their lifestyle modifiable behaviors, then we just get them back in again with a cancer recurrence or something, or another comorbidity. So this is the gap we face. We also don't talk much about childhood cancers very much, and every 20 seconds a child is diagnosed with cancer. My research now is looking at survivors of youth cancer. And the sad part about this, and that we need to discuss, is that so many late treatment effects happen because this aggressive treatment is happening at a time when these children are going through developmental stages, both mentally and physically. And the toxicities of these treatment can be so harmful, leading to future comorbidities. Many of the treatments increase the risk for obesity into early adulthood and all-cause mortality. So meet Kylie. Kylie is a beautiful 11-year-old girl who in 2014 was diagnosed with a brain tumor. She went through aggressive therapies, including surgery, radiation, and chemotherapy. And sadly, in 2016, she had a recurrence. There's also another group we don't talk about very much, and that is the caregivers of survivors of youth cancer. And so this is Kylie's mom. Her name is Laura. Laura is a fierce advocate for Kylie, but we know statistically that mothers of children with cancer suffer, 20% of them suffer post-traumatic stress, and many more than that suffer anxiety and depression. And I've gotten to spend a lot of time with Kylie and her mom at our garden, and occasionally I catch a glimpse behind her strong facade and how she's supportive of Kaylee when she kind of flashes back and sees pictures of this. How can you not be depressed? That's Kylie in that bed. And it reminds me for a brief second of when I was 11. This is my brother Jamie, and my mother was a caregiver for Jamie for 5 years before he lost his battle to cancer at age 15. So my journey at Ohio State is both personal and professional. And I came back from my PhD in my 40s. I've been on faculty for 6 years. And this call to action led me to our beautiful living laboratory at WATERMAN Farms, which is just right down the road at the corner of Lane Avenue and Kenny Road. I'm sure many of you have driven by. That is a 261-acre living laboratory where research is conducted. And we are the first researchers who have come in and brought kind of a community perspective and really a model of a land-grant university from truly crop to clinic to community. And this is where we conduct our research. You can see in the white circles that these are our research laboratories, which again are gardens, beautiful gardens. So our strategy is very simple yet very intensive. And really, our main goal is to improve the lives of cancer survivors and other vulnerable populations now, but also to increase their adherence to the evidence-based recommendations for dietary patterns and physical activity patterns. And how we do that, you see Kaylee here again on the left, and this was her last day when she got to ring the bell of her active treatment after her 2016 recurrence. And she comes to see us, as well as our other survivors, when they're very vulnerable. It's a time when they've just lost their care team, and they're not really sure what their next step is. And we try to capture them in these teachable moments when they're looking for help. And this is where we find that they're most likely to turn to purveyors of misinformation and non-evidence-based information. So we try to grab them at this place and lead them to a new normal, so to speak, where they can reroot and regrow their roots in a healthy way. We invite their caregivers out. So Kaylee, for instance, would come out and see us for about 12 weeks. She brings her mom with her because it's a family event. And eating is a family event. Much physical activity for children is a family event. And what we do is we provide group education. They go out and harvest. We bring the food in. We have a cooking demo where they get to eat that very food and try it out. And then they get to take home that food. We also provide remote technologies. You see Kaylee on the bottom right showing off her new Fitbit, so that's pretty fun for everybody. We also provide remote motivational interviewing counseling by registered dietitians who are trained and competent and have fidelity checks. Their job is to support the evidence, but do it in a way that empowers Kaylee and her mom to make the goals for themselves, and we help to support them in achieving it. So it's very individual. It's not cookie cutter at all. So it's intensive, but it speaks to everyone because everyone has a different story and everyone has a different barrier they need to overcome. And our results are astounding. This is hard science, folks. I mean, what we do is we do have mixed methods, so we measure things like quality of life. And I will tell you, in every trial we've conducted to date, we have seen significant improvements in quality of life for both the caregivers and the patients. We show changes in dietary and physical activity patterns measured by Fitbits and wearable trackers and by diet quality scores. Health indices, we are measuring things like body composition and body fat and different segmental parts of the body. We're measuring functional status, both physical and mental functional status. We're measuring things like inflammatory metabolic markers, and we're showing significant and clinical improvements in cardiometabolic risks. We now are also measuring urine metabolites and gut microbes. So this is, yes, a behavioral intervention, but we are doing hard science to back it up, and that's what we find no one else in the nation is currently doing. But again, at the end of the day, that quality of life is so important because that's what it's about, right? And also family engagement. In our youth now, we are measuring engagement with families and dynamics, and we are finding them coming together as a family out to the garden and going through our behavioral intervention. They're actually going home and spending more time together. They grocery shop now together. They're cooking together, and they report better family functioning. And again, what a blessing to be able to reset that relationship Kaylee and Laura had where she was dragging her to all these appointments that she didn't want to go to, right? Now they have a new normal. So we're definitely expanding our ripple. And again, right here at the corner of Lane and Kenny, we have folks coming to see what's going on at this garden, at this land-grant university. We've been visited by leadership from the American Institute for Cancer Research. The American Cancer Society has sent leadership out here and also funded us. And the USDA has funded a 5-year study. My entire lab is over there right now launching this study tonight. And this study, because this is replicable and we are ready to scale up now, we've adapted it first with adult survivors, and then we are now doing pediatric survivors and their families. And the USDA grant actually is an obesity prevention, where we are taking 240 children from pockets of low-income neighborhoods in Columbus and pockets of food insecurity. And we are bringing them and their parents out to the garden so that they can harvest together and cook together and get nutrition education. It's a beautiful thing. So about that ripple, you all are part of my ripple too. Again, I stand on giants at The Ohio State University who support. When I had come up with the crazy idea, they say, do it, go for it, how can we help? And I appreciate that. But more than that, all the rest of you, every time you give your time, talent, treasure, a word of support or encouragement or volunteer at my garden, you are handing each of our researchers a stone, a pebble, that we can throw down and start the ripple. So thank you for being part of our ripple.